Hello everyone, I'm Dr. Santoshi Nandigam, Consultant Obstetrician and Gynecologist in Cadence Hospitals, Kodambakkam, Chennai. Welcome to my YouTube channel. You just realized that you're pregnant and you are unable to visit a gynecologist. And let's say in the next couple of days or 2 weeks or 3 weeks or probably even a month, because you're stuck in a different place or stuck in situations when you cannot just go to a gynecologist immediately. So, but there are certain blood tests which you should be doing almost immediately after you get pregnant. And this video is about what are the blood tests that you should be taking immediately after you realize that you're pregnant. The first and the foremost one is a beta HCG. Well, this does not apply to all the pregnant women, but for the women who notice a faint positive or a weakly positive urine pregnancy test. So, namalki ellarkume theriyum urine pregnancy test la 2 strong pink lines vanduchuna, it means you're pregnant. So sometimes we don't see 2 strong pink lines. We only see 1 pink line and a faint pink line. So does that mean we are pregnant, or does that mean we are not pregnant, or what is it? So in that case, you should be taking a serum or a blood beta HCG. So this is the first important blood test. Again, I'm telling you, it does not apply to all the women, but only to women who visualize a faintly positive beta HCG. The second blood test is a complete blood count, which means it'll show your hemoglobin level. So hemoglobin is a substance which carries oxygen and the required nutrients in our body. The more the hemoglobin, the better, the normal the hemoglobin, the better is the capability for the organs to function. So when someone does not have adequate levels of hemoglobin, they are called as anemic. Anemia சொல்லுவாங்க. அவங்க bloodல வந்து required amount of hemoglobin இல்ல. Which means over time their organs have to overdo, they have to overwork to go about by their daily routine activities. So the lesser the hemoglobin, the more fatigued you become, and anemia in pregnancy is a very complicated situation to deal with, and it has so many consequences. It can affect the growth of the baby, it can lead to growth restriction, it can affect the weight of the baby, it leads to low birth weight babies, so on and so forth. So anemia kandipa namalala as early as possible kandipudicheda. The third is a thyroid profile. Of late, there is an increase in the incidence of thyroid disorders in women. So uncontrolled thyroid problem, let's say hyper or a hypothyroidism, can actually affect the pregnancy drastically. So there are studies which show that uncontrolled hypothyroid has actually led to miscarriage or even affected the brain development of the baby. So this is one of the tests which you have to include and do it as early as possible, or as you realize that you're pregnant. The fourth one is a fasting and a postprandial blood sugar. So diabetes is also on the rise in our Indian population, and of late I see many young people in their 25s, in their 30s, early 30s or late 20s turning out to be diabetics. They probably will not have any symptoms typical of a diabetes, but when we do their test, we realize that they are diabetic and they have really bad uncontrolled sugars. So uncontrolled diabetes also increases your chance of miscarriage, and we need to control the sugar as early as possible to prevent any future complications. So it also leads to big baby or large for gestational age soluvanga. The baby is higher in weight, especially when the mother's sugars are really bad, really uncontrolled, or not detected before pregnancy. The final blood test that you should be doing is a blood grouping and typing. So everybody should know their blood group, and they should have a printed copy of their blood group. It's so common for people to get confused with their blood group. I have many of my patients who come to me and say their blood group is A positive. When we do a blood test, it turns out to be O positive, so on and so forth. So having a printed report of your blood group is extremely important. There is another reason why I'm asking you to do a blood group test. We will talk more about it in my upcoming videos. Please subscribe to my YouTube channel to know more. Thank you.